Cranial nerves. Cranial nerve number 1, the olfactory nerve. Function is the sense of smell. Clinical examination. With his eyes closed, the patient identifies familiar odors, coffee and tobacco. Each nostril is tested separately. The second cranial nerve, the optic nerve. The function is visual acuity. Clinical examination, the Snellen eye chart, visual fields, fundoscopic examination. The third cranial nerve, the oculomotor nerve. Its function is extraocular movements. Clinical examination, extraocular movement assessment. The fourth cranial nerve is the trochlear nerve. Its function is pupillary constriction. Clinical examination, it is an assessment of size, shape, and equality of the pupils. The fifth cranial nerve is the trigeminal nerve. Its functions are facial sensation, corneal reflex, and mastication. The clinical examination for facial sensation is to have the patient close his eyes, touch cotton to forehead, cheek, and jaw. Opposite sides of face are compared. Sensitivity to superficial pain is tested by using a safety pin. Alternate between the sharp point and the dull end. Patient reports sharp or dull with each movement. If responses are incorrect, test for temperature sensation. Test tubes of cold and hot water are used alternately. The clinical exam for corneal reflex. While the patient looks up, lightly touch a wisp of cotton against the temporal surfaces of each cornea. A blink and tear is a normal response. The clinical exam for mastication is to have the patient clench his jaw and move it from side to side. Palpate the master and temporal muscles, noting strength and equality.
Mr. Mark, what are you doing?
I don't know.
You're at ramp 2. He's handling the missile.
No. Those are missiles. They could be nuclear weapons.
Then stop me, for the love of God.
The sixth cranial nerve is the abducens nerve. The function of this nerve is eyelid elevation. The clinical examination for this nerve is direct and indirect light reflex and pupillary accommodation reflex. The seventh cranial nerve is the facial nerve. The functions of the facial nerve are facial muscle movement and taste on the anterior 2/3 of the tongue. The clinical exam for facial muscle movement is to observe face for flaccid paralysis, shallow nasolabial folds. Observe for symmetry while the patient performs facial movements. smile, whistle, elevation of eyebrows, frown, tight closure of eyelids against resistance. The examiner attempts to open them. The clinical examination for taste on the anterior two-thirds of the tongue is that the patient extends his tongue. His ability to discriminate between sugar and salt is tested. The eighth cranial nerve is the auditory nerve. The function of this nerve is hearing. The clinical examination for this nerve is the whisper or watch-tick test, test for lateralization, and test for air and bone conduction. The ninth cranial nerve is the glossopharyngeal nerve. The function of this nerve is taste on the posterior one-third of the tongue. The clinical examination for this nerve is to assess the patient's ability to discriminate between sugar and salt on the posterior one-third of the tongue. The 10th cranial nerve is the vagus nerve. The functions of this nerve are pharyngeal contraction, symmetrical movement of vocal cords, and symmetrical movement of soft palate. The clinical examination for pharyngeal contraction is to depress a tongue blade on posterior tongue or stimulate posterior pharynx to elicit the gag reflex. The clinical examination for symmetrical movement of vocal cords is to note any hoarseness in the voice. The clinical examination for symmetrical movement of soft palate is to have the patient say ah and observe symmetrical rise of uvula and soft palate. The 11th cranial nerve is the spinal accessory nerve. The function of this nerve is the movement of the sternocleidomastoid and trapezius muscles. The clinical examination is to palpate and note the strength of the trapezius muscles while the patient shrugs his shoulders against resistance. The second type of clinical examination is to palpate and note the strength of each sternocleidomastoid muscle as the patient turns his head against opposing pressure of the examiner's hand. The 12th and last cranial nerve is the hypoglossal nerve. The function of this nerve is the movement of the tongue. The clinical examination for this nerve is that while the patient protrudes his tongue, any deviation or tremors are noted. The strength of the tongue is tested by having the patient move his protruded tongue from side to side against a tongue depressor.